continue on the subject of skin lesions again, because that is a very important subject which is taken very lightly. And a lot of times we see that lesions like this are treated by people who are non-medics, who don't have any medical knowledge, and they are starting to treating patients in the salons or even, I don't know, places. They take a laser or an IPL and they start to zap this sort of lesion, considering that they are pigmentation or they are basically seborrheic keratosis. If you look at this lesion carefully, you would notice that there is areas of regression, asymmetry, and different colors, a bit of blue-white shadow on the lesion, and it's actually demonstrating the characteristic of a melanoma in dermoscopic examination. So when you look at the lesion macroscopically, it's actually, you don't see anything out of place with it. So it could be considered a pigmentation. It's only while you're looking in an expert eye with the dermoscope, you're looking at the lesion, you would notice that there are problem issues with the lesion. Now I want to show you the marking of the surgeon during the day of surgery and the borders of how our consultant dermatologist is marking in the theater for the excision of the lesion, for going to the path lab. So this is actually the marking of the lesion in the theater. So, and then we are going to go to what it looked after the stitching and cutting. If you can see, it was basically a major deep cut. We had to go to the depth of the lesion, 5 millimeter or even more when you're considering melanoma, to make sure that you're clearing the lesion of patient. These lesions a lot of times go misdiagnosed. So I emphasize, please, if there is any pigmentation, any lesion on your body, get an expert, someone who's trained in dermoscopy, someone who's trained in dermatology, to have a look at the lesion. Doctors, if they don't see lesions day in, day out, 5, 6 lesions on a regular basis, their eyes is not trained to recognize the difference between a benign lesion and one which is sinister. I always say, even under the hands of the most expert dermatologists, the dermoscopists, things get missed out. That's why we send it to the pathology. When we send the lesions for pathology, even pathologists, they consult with each other, they escalate, they send it for a second and third opinion. And even in those circumstances, they're not sure. They could be not sure. They take it to the MDT meetings and they discuss about the lesion to come to conclusion to what to do for the patient. So I am surprised how come health matters nowadays are becoming so lightly and are getting out of controls. We get so many skin lesions which had been treated by people with no knowledge, considering that they are tags, they are pigmentation, they are sun damage, and they keep treating these lesions without any knowledge. Please make sure you get your skin lesions checked by an expert doctor. Thank you.